The first is that so far we discussed about epidemiology, how common it is ARDS, how it is mortality, what are the common causes of ARDS, pulmonary, extrapulmonary and second hit. Next is that what is the triad of acute respiratory syndrome? It's ARDS actually, it's a non-pneumonic, non-cardiogenic condition characterized by triad, like say increased vascular permeability which leads to pulmonary edema. Because of this increased pulmonary edema, it causes severe arterial hypoxia. These three triads, you say increased vascular permeability, pulmonary edema or severe arterial hypoxemia. This clinical triad, if you found any patients in your ICU with this clinical triad, you have to think about it may be a ARDS. So why it is that? What is the pathophysiology of the ARDS? Before to discuss about the diseased status, first you have to know that how that alveolar capillary membrane will look. So what is a normal alveolar capillary membrane? So any hallmark of the ARDS is diffuse alveolar damage. This is called hallmark of ARDS. So far, if it is diffuse alveolar damage, means that ARDS will damage the alveolar capillary membrane. How the normal alveolar capillary membrane look? This is your alveolar. This is your alveolus. This is your alveolar epithelium. This is your type 1 alveolar epithelial cells. These are the type 2 alveolar epithelial cells. This is type 2. This is type 1. In between, there is a tight junction used to be there. In that, there is a glycocalyx also will be there in the alveolar side. These type 2 cells usually will produce a surfactant. The common function, what is the function of that normal alveolar epithelium is production of surfactant. Second thing, they have covered by the anticoagulant to prevent the fibrin formation within the alveoli. Second thing, these alveoli have the pump. These pumps will keep the alveoli dry. If any damage in these alveolar epithelial cells will cause decreased surfactant production, it can cause alveolar collapse. If it is alveolar, the other function is that alveolar epithelial function is keep the alveolar dry. So if any alveolar epithelial injury will leads to alveolar flooding. So it will cause hypoxia, obviously it's a shunting. The loss of anticoagulant factors leads to procoagulant condition, it calls fibrin deposits on the alveolar capillary membrane. So what is the other things is so far we discussed of the alveolar epithelial cells. Next is if you see in between the alveolar epithelial cells and your capillary, this is your capillary, this is your alveolar epithelial cell, in between your thin membrane is called basement membrane. Next to the basement membrane, we will see the capillaries. This alveolar pulmonary artery capillaries. Here you see the endothelium and the glycocalyx. So it is that these capillaries, the basement membrane is separating the alveolar epithelial cells and the endothelial cap. If it is patient having any lung injury, it may be ARDS or it may be an infection or it may be a drowning, whatever that. So it leads to the first thing, it leads to the epithelial injury or sometimes it will activate the macrophages. What happened to the, if it is my epithelials injured? Because of the direct injury, whatever the extrapulmonary or pulmonary, my alveoli epithelials have got injury. I already told that the epithelial, the function is to pump back the alveolar fluid to your capillaries. If this fail, what happened? The alveolar will be flooded with the fluids. Okay, this is called, it's not called hydrostatic edema, it's called inflammatory non-hydrostatic edema because alveolar epithelial cells are damaged and alveolar and capillary endothelium also damaged, leads to leaky capillaries. These fluids goes to the alveoli. Normally, these fluids are pumped out by the alveolar epithelial cells. If these cells are also damaged, so alveolar flooding will occur. What happens if alveolar fluids will come? These fluids will deactivate your surfactant. So all these cause hypoxia and alveolar, it's lung collapse. It's a mild ARDS. If it is severe one, it's my alveolar cells are damaged completely, it's destroyed, or alveolar basement membranes are damaged, my capillary endotheliums are damaged. What happened? All that is a severe alveolar flooding will occur. There will be no surfactant. So it will be filled with, alveolus are collapsed sometimes, or it may be filled with water. This I already told that these alveolar epithelial cells are covered by anticoagulant factors. So if it is injury to this alveolar epithelial cell, there is a shedding of anticoagulant and also releasing of the tissue factor within the alveoli. It makes the alveolar fluids as a procoagulant condition, it produces the fibrin deposits. So these fibrin deposits or deposits around the alveolar membrane. So it's called, that is called hyaline membrane. Okay. So the deposits of hyaline membrane with neutrophilic alveolitis are, it's a hallmark of ARDS. So if it is normally if it damage to alveolar epithelial cells and capillary endothelium will leads to alveolar flooding and loss of surfactant, leads to the alveolar flooding and alveolar collapse, loss of anticoagulant, it leads to the procoagulant condition in alveoli, which leads to a hyaline fibrin membrane formation with deposit over the alveolar basement membrane. It's a hallmark of ARDS. Other thing is that this endothelial injury also leads to makes the thrombotic condition in the capillaries. It causes the thrombus formation in the capillaries. So the thrombus formation in the microvascular structure, capillaries, pulmonary artery capillaries, and the hyaline deposits on the alveolar basement membrane is the hallmark of histopathological feature of ARDS.